Today, I like to stand up for doctors. I think doctors deserve a little break. We're always getting a bad rep or a bad rap for things that are completely out of our control. So today I'd like to speak on behalf of all physicians who try to do their best and give people the best care possible. Even under these circumstances, there are situations outside our control that actually affect the way we take care of people. For example, many years ago, not that long ago, maybe 20 years ago or so, we were very careful as to how much opioids and other pain meds we would prescribe to our patients. We would try and limit that as much as possible, giving them what we think they need and not much more than that. Well, what happened is that we were considered bad guys. We were limiting, they were having too much pain, we were considered not compassionate and sympathetic enough. We even had special charts for our patients that went from a smiley face all the way to a frowning face that's crying. And based on that, people would get medications, and of course everybody would point towards the frowning face. So we were considered good guys because we were giving people medication, and we were considered empathetic. All of a sudden, lately now, the whole thing has been turned around. All of a sudden, people have there's an opioid epidemic, and people are have too much medication on board. There are even cases of chronic constipation with opioids. That indeed may be a problem, and again now we're considered bad guys because we give too much medication. The problem is many people who are opioid addicted are addicted in opioids that are beyond our control. Not all opioids that people are taking have been prescribed by doctors. So the most recent publication from one of the states that I work in, we now have the Surgeon General directing how much opioids we can prescribe to people. At the same time, in the same journal, we have medical marijuana, and the fact that we can now prescribe medical marijuana to minors. So there seems to be a little bit of a conflict as to where we're going, and of course us as physicians are kind of stuck in the middle between being a bad guy or a good guy. On one hand, we're supposed to limit the amount of prescriptions of pain meds we give our patients, and on the other hand, we are now allowed to give medical marijuana even to minors. Obviously, we're in the hopes that medical marijuana is going to somehow alleviate many of the problems that people have, and of course, we're hoping that medical marijuana becomes miracle-wana. A drug that will help in all sorts of ways. I'm sure it will come back and have problems with this drug as well. All I want to say is that we try to do our best, and hopefully people will understand that 90% of the problems that are out there have nothing to do with the amount of goodwill and care that doctors try to provide in their office. Many of the things are beyond our control, and many of the medications that people are taking are not under a physician's control.
Please visit www.cosmetic-surge.com.